This presentation is going to focus on epilepsy and more specifically, epilepsy in the classroom. Epilepsy is actually more common than most people realize. In fact, Roberts and Whiting tell us that epilepsy is one of the most frequently diagnosed neurological disorders among children. Approximately 4 in 1,000 adolescents have epilepsy. This prevalence is about 10 times higher for those that are in the special education program. What we need to know about epilepsy in the classroom. We need to have an understanding of what epilepsy and seizures are, the differences between the two, as well as how they come together. We need to know what are the causes and symptoms of epilepsy and the treatment options, as well as the possible cures for this disorder. The perceptions and experiences of educators of children with epilepsy is critical for those that are considering or will be instructing in the classroom, especially considering how prevalent and common epilepsy is. We need to have an understanding of the impact that living with epilepsy has on both the children and their families in terms of quality of life. And finally, we need to understand how families think schools and those involved can best support and accommodate, as well as prepare their children for the future. So to start with, we need to have a good understanding of what epilepsy is, and more specifically, what seizures are. So to understand epilepsy, we need to realize that it is a neurological condition that affects the brain and causes seizures. It's a pretty basic explanation. It gets a little more tricky when it comes to understanding a seizure. A seizure is an interruption to the electrical transmission between neurons. In order to be diagnosed with epilepsy, an individual is going to have to experience at least 2 seizures that are not the result of another known medical condition, and these seizures must occur at least 24 hours apart from each other. Surprisingly, it's not necessary to know the cause of the seizure in order to be diagnosed with epilepsy, and most often the cause of the seizure is never known. So it's possible to have an epilepsy diagnosis and never know why you're having these seizures. So what causes a seizure? When an individual has a seizure, their brain cells are either excited or inhibited by the other cells in the brain. And these other cells are attempting to transmit or communicate information, but there's too much or too little brain activity going on at that time. This leads to an imbalance of the exciting and stopping activity in the brain. The chemical changes caused by this activity can lead to surges of electrical brain activity, and the result is a seizure. Seizures themselves are not a disease, so you cannot be diagnosed with seizures. Seizures are actually an indication of another disorder that is occurring that affects the brain. There are 3 types of seizures. The first is generalized onset seizure. The second is focal onset seizure. And the third is unknown onset seizure. So these are basically categories, and it's possible for seizures to be more than one. So you can have a generalized onset seizure and experience different types of generalized onset seizures. So we're going to talk a little bit more about these different types. Let's start with generalized onset seizure. The Epilepsy Foundation describes this type of seizure as associated motor symptoms that include clonic or sustained rhythmical jerking movements. This is the most common impression that people have when they think of a seizure. This is the seizure that they're talking about, or this is the one they're referring to most often. There's also atonic, which is where the muscles become weak or limp. There's tonic, where muscles become really tense or rigid. Myoclonus, which is a brief muscle twitching. And then finally, epileptic spasms, where the body flexes or extends repeatedly. And that's another more common image that people have when they're thinking of seizures, those 2 in particular. The other one that's pretty common, but less more so, is the absence seizure. And this is considered a non-motor symptom, where it's also known as a staring spell. And in this situation, you may also have brief twitches that affect a specific part of the body, most commonly the eyelids. But those are kind of like the daydreaming or staring spells, the other kind of more common seizure that people are familiar with. When it comes to focal onset seizure, this occurs when a person is awake and they are aware that the seizure is happening. A focal onset impaired awareness seizure occurs when a person is disoriented or their awareness is affected during the seizure. And according to the Epilepsy Foundation, motor symptoms associated with this type of seizure are the same as those that we listed for the general onset seizure, but they may also include automatisms or repeated automatic movements. So repeatedly clapping or rubbing hands together, lip smacking, chewing, or running. The non-motor symptoms that are associated with this type of seizure include changes in sensation, emotions, thinking, or cognition. It also includes autonomic functions like gastrointestinal sensations, feeling a wave of heat or cold, goosebumps, your heart racing. And then there's also lack of movement, which is also referred to as behavior arrest, where you're just frozen. Finally, we'll discuss the unknown onset seizure type. This type of seizure occurs, and when it does, it is unclear when the seizure began, or there was no one there to witness it. So sometimes you may not be aware when the seizure occurred if you're having the seizure, but someone was there to witness, and they can tell the length and the type of seizure, so they can give you more detail. It can be categorized as one of the other two. But if there's no witness and you're unaware of what happened during your seizure, then it will be diagnosed as an unknown onset seizure. And these are described as tonic, clonic, or epileptic spasms. And they can also include the behavior arrest type. And when it comes to this type of seizure, some families of children did not recognize these symptoms as epilepsy. A lot of times they were misdiagnosed as ADHD or daydreaming or blank stares, those staring spells that we discussed earlier. And that's pretty common, so a lot of times it will be diagnosed as unknown. Now, some other causes of epilepsy include when you have structural changes in the brain, or scarring on the brain may cause seizures and a diagnosis of epilepsy. Some types of infections, head injuries, strokes, tumors, Alzheimer's disease, and autism spectrum disorder can all be associated with causes of epilepsy. But again, as I mentioned before, over half the time, the cause for the seizure is unknown, or the cause for the diagnosis of epilepsy itself is unknown. When it comes to treatment, the first thing that we need to take into account and be very aware of is that the treatment for epilepsy begins with awareness and communication. As with any disorder, ideally everyone should know how to respond to an individual that is having a seizure. They should be able to recognize it as a seizure and know how to handle that situation when it occurs. We also, as with any disorder, need to treat the child that is diagnosed with epilepsy as an individual and not a condition. And finally, the goal for treatment of epilepsy is to stop all future seizures from happening in the future and to prevent or eliminate any of the side effects that may be a result from previous seizures. And this is most often attempted through the use of an oral medication called anti-epileptic drugs. The other options include surgery, the ketogenic diet, alternative options, which we'll discuss in more detail, or a combination of all of these. So when we talk about anti-epileptic drugs, which are most often referred to as AEDs, this is the most common type of treatment for seizures. And these are often prescribed, again, after the patient has had 2 unprovoked seizures that are at least 24 hours apart. It's the most common treatment for anyone diagnosed with epilepsy. There are about 31 different types of prescription medications that can be used to treat epilepsy. And oftentimes there is a trial and error period where the doctor and the patient are working together to find the right combination of prescription dosage for the individual that allows them to manage the side effects of those prescriptions. Other considerations for AEDs include the patient's other medical conditions. So if they have other prescription medications or they have other medical conditions that would interfere with AEDs, Also the severity of the seizures, the potential risk of injury from these seizures, and the potential psychosocial fallout from having seizures. Another common option, although less common, is surgery. Those that are considered good candidates for surgery include individuals that are diagnosed with epilepsy that do not respond well or at all to the AEDs, those that have extremely difficult to control seizures, or that are very risky and potentially dangerous that need to be under control immediately, and those that suffer from structural brain problems. We discussed additional treatment options earlier, and some of those include the ketogenic diet. In fact, it's common for those that are diagnosed with epilepsy to have a recommendation from their doctor to start this diet in addition to the AEDs, although some prefer to do exclusively the ketogenic diet initially before adding in other options. There's also nerve stimulation devices that may be recommended, especially if the AEDs are not beneficial and improving their quality of life. And then finally, there are some alternative therapies that some consider, and that's more of a lifestyle change in addition to diet. So it can be acupuncture, it can be yoga or other types of therapy that some people incorporate into their lifestyle after the diagnosis. When it comes to living with epilepsy, it's important to understand that children that are diagnosed with epilepsy have several areas of concern, the first of which include the impact that epilepsy has on their mood and behavior. It is quite common for individuals that are diagnosed with epilepsy to experience depression and anxiety, in addition to just overall moodiness or changes in behavior, personality. Sometimes you have to treat those symptoms separately from the treatments for epilepsy itself. We also need to understand that there are often cognitive or learning problems, such as poor performance in school for students that are diagnosed with epilepsy. Those that have epilepsy tend to struggle not only at home, but at school and in general in social situations. These individuals tend to have trouble sleeping, and they have quite often other unrelated and inexplicable injuries or illnesses. And then finally, there is an increased risk of death for children or individuals diagnosed with epilepsy. A lot of this can tie back to the depression. So it's really important to keep a very close eye on any students in the classroom that are diagnosed with epilepsy, especially paying close attention to any indicators for depression or anxiety. So when it comes to the emotional and behavioral concerns for students that are diagnosed with epilepsy, we need to take into account that they often are experiencing irritability, hyperactivity, hostility, and general personality changes. Now, sometimes this is a result of the AEDs and not necessarily the result of the epilepsy diagnosis itself, but it's certainly something that we need to be aware of and prepared for. And we also need to understand that either the epilepsy, which is the changes in the brain, or the AEDs themselves can lead to disrupting attention and focus. It can also come into play in terms of ability to process language or produce speech, which is a little less common, but that is a possible concern in relation to epilepsy. And finally, motor coordination or strength, especially during the time period right after having a seizure. It's important to understand that children with epilepsy are at a higher risk for experiencing anxiety and depression, as I mentioned before. And so in addition to being aware of other side effects, it's something that teachers need to pay extremely close attention to when instructing children with epilepsy in their class. Other school-related concerns include that these children are at a higher risk for grade retention, as well as long-term learning problems. So it's also important for us to understand that it is quite likely that some of these effects are not just due to the epilepsy diagnosis itself, but may be a result of the AEDs that they're taking. However, it's more important to take these AEDs and stop the seizures than it is to do away with those because of the potential side effects of the drugs. So we need to understand the impact that they may have on the children in the classroom. And that includes struggle with short-term memory recall, struggle with focus on concentration and focusing in general, and then just overall slowed down thinking. So a lot of times this in the classroom can manifest itself as response time. And so that's something that teachers need to pay close attention to when instructing in the classroom, especially if they have students with diagnosed with epilepsy. These students also suffer from a decreased ability to relate to visual scanning, spatial skills, attention, and memory. So again, something to be aware of when in the classroom. When it comes to social concerns, epilepsy is associated with underachievement at school, physical restrictions, lower social competence, less social contact, and higher rates of psychological and behavioral problems. So we need to understand that children with epilepsy have a reduced health-related quality of life. And when it comes to supporting those students in the classroom, as a teacher, we need to balance their involvement in the instruction as well as in the social aspects of the classroom and be that bridge for our students and set them up for success in their social relationships as well as their academic. Supporting students with epilepsy requires us to expect and plan for the following. Students that have epilepsy tend to have higher rates of absenteeism. Part of this is due to the fact that it takes a while to find the right combination of dosage for the AEDs for those that are taking AEDs. And so initially, especially, there may be additional doctor's appointments and time at school missed for these appointments in order to find the correct dosage. But even once that's settled in, absenteeism does tend to stay at a higher rate for these students. We also need to support students and their families when it comes to creating and implementing IEPs. We need to offer modifications to the classroom as well as the instructional practices within the classroom to support their needs based on some of the struggles we've discussed in this presentation. It's important that teachers provide an inclusive environment for academic as well as social activities. They do believe, research has supported that mainstream education in the general ed classroom is best for students with epilepsy. We also need to support these students and their families with frequent and ongoing communication. So we need to tell the families what's going on a daily situation, communicate anything we indicate or see or notice, especially when it comes to behavior, because as we've mentioned several times, depression and anxiety are common side effects of students with epilepsy. And so we need to be very vigilant when it comes to communicating anything in these areas in particular. It also requires flexibility for these students and their families in terms of the curriculum, the privacy of their diagnosis, the symptoms as a result of this diagnosis, and the treatment and whatever that requires. When it comes to classroom and instructional modifications, again, it's important that teachers prepare for mainstreaming and inclusive practices in the classroom. And again, just to reiterate, this is not just from an academic perspective, but a social one as well. It's really important to understand that. Modifications to instruction and assessments must be done, and we'll discuss it in detail in terms of providing redirection, providing cueing, and providing one-on-one instruction. Most specifically, I find the research indicates that we need to provide wait time in terms of questions and answering, and we need to provide lots of repetition for our students in the classroom. So when asking questions, ask it several times, ask it in different ways in order to provide the student with more time to process the question as well as process a response. The suggestions for assistive devices in the classroom include a glare guard and the avoidance of repetitive images. And that's because the flickering that sometimes come with monitors can lead to seizures. And so we want to avoid those repetitive flickering images as well as loud, sudden noises. Electronic organizers can be helpful to keep these students organized and focused and keep their attention on the priorities. We also offer or suggest picture exchange communication systems, audio-based resources, and a book stand or slant boards. As with anything, it's really important to educate the educator, and I find that it's extremely important for all academic professionals to become educated on epilepsy, how it affects those with this diagnosis, and the causes and symptoms of epilepsy and seizures. A resource that I have found to be especially helpful is the Epilepsy Foundation, which is located at epilepsy.com. There's great resources for teachers, for parents, for students, and also access to local epilepsy resources in your area. To be successful in the classroom, teachers need to have a clear understanding and a well thought out plan that includes the implementation of necessary accommodations and supports that these students need. This is essential for a successful and quality learning environment for students with epilepsy.